Barriers in implementing evidence-based care among nurses, project proposal. Evidence-based practice or care, EBP, suggests applying accumulated or acquired practical knowledge for current and future clinical practice. Knowledge may come from within or from external sources. Nurses are expected to update their knowledge by cultivating evidence-based practice. This is not unique to nursing or, for that matter, healthcare profession alone. The need for evidence-based practice is pervasive in all professions. Professionals generally tend to stick to what they learned in their professional courses and traditional practices. They tend to resist the introduction of new practices to replace age-old and time-tested ones. Resistance to change is one of the barriers to the implementation of evidence-based practice in the nursing profession. With this background, this paper seeks to examine the potential barriers to EBP, including the resistance to change. The aim and objective of this essay is, therefore, to identify the barriers to implementing evidence-based care among nurses. In this connection, it is emphasized that the concept of evidence-based practice is just the old wine in a new bottle, for any theory is generally based on previous practice. Hence, what nurses learn in their classrooms are the grounded theories based on clinical practices on a trial-and-error basis refined over the years. There must have been resistance or barriers to establishing the grounded theories for nursing professionals to follow even earlier, and new knowledge might have taken longer time than is necessary to get established. If modern-day professionals resist changes or fail to overcome barriers, there will be a dearth of new theories for the growth of professional knowledge. This does not augur well for the well-being of mankind. The barriers to EBP are many and have been a nagging problem for the nursing profession, basically because of the ever-growing body of knowledge. In this project, it is proposed to examine two issues: 1. Resistance to change, and 2. Other barriers. Resistance to change is a human tendency. To tackle it, as a separate branch of management practice, change management has been developed in recent years. Concerns about resistance to change stem from the need to provide the highest quality, safest care possible to the greatest number of people in the most effective manner. Nursing is mainly concerned with patient safety, and research in this area draws heavily from other professions like mining, aviation, and rail. As a result, health management now embodies quality movements ranging from total quality management and continuous quality improvement to Six Sigma and lean thinking, and includes implementing changes aimed at improvement in clinical practice. Resistance to change stems from the feeling of uncertainty related to job security, concerns with an increased workload, and unfounded fears about the impact on patient care. Other barriers to EBP include time factors, inaccessibility of the literature, lack of competency to critically evaluate empirical research, lukewarm interest in scientific inquiry among nursing professionals, work environment that is not friendly towards evidence-based practice, and so on.